Today's lecture is from research methods and it's about data collection techniques. We had lecture 1 on introduction to research methods. We had lecture 2 on research designs and we saw its importance in research. And the lecture 3 was about sampling and sampling techniques. Lecture 4 is going to be about data collection techniques. We shall find out that lecture 5 will be following this one in the order. We might discuss literature review or we might discuss ethics. I will see on my curriculum map the one I'm following to make these lectures. However, let's get oriented with today's lecture about data collection techniques. It's very important. We are trying to move in a very slow manner such that we can learn all the aspects of research. If you haven't been around in the previous lectures, I would urge you go and watch those videos on YouTube. They were uploaded. They were uploaded on YouTube. Okay, let's get started. Today's lecture objectives are as displayed here. We have 4 objectives to achieve. That is define the terms related to data collection methods in research, discuss the data collection tools or instruments. We shall also discuss the types of data collection methods and we shall learn the community engagement strategies. How do you engage your community when you go to collect their data? Without wasting time, the terms used in data collection, we have data collection itself. It's the process of gathering information on data from various sources for research or analysis purposes. We gather our research data from our participants, that is a primary study, or we can gather our data from already available research, and that is a secondary research studies. In our introduction to research, we saw these types of research, everything in details. Then quantitative and qualitative data, we also saw these types of data under research designs, and I guess people understood very well. However, as we said, quantitative data deals with the numerical data, and these can be measured, you get, and expressed as numerical values. Then in qualitative data, it is the non-numerical data. In other words, you try to describe the situation, how the situation is occurring in an area. So we don't expect you to give results when you have values there, unless it is a mixed type of data whereby you have both quantitative and qualitative research types. We have survey as a term. It is a research method used to collect data from a sample of individuals through questionnaires, interviews, or observations. We are going to see this method in the details under the types of research methods. Other terms that we use under data collection, we have validity. You know, this is very important because as a researcher, you have the first 2 goals to achieve, that is validity and reliability. Is your work valid? Are there any evidences that can be based on to say that your study is a valid study? Are there any evidence to prove that your work is a valid work? Did you find out, did you get valid findings? So that is why validity is an important term here. Reliability, it is the consistency or stability of a measure over time or across different conditions. Consistency or stability. Many researchers to consider your work perhaps as a reference, because even someone who will do a primary research will have to perform a literature review on the available data about that particular problem. Therefore, for that individual to rely on your data, there must be ways to approve that this work is, we can really rely on it. However, it begins with validity. Your work must first be valid, then becomes reliable for others to rely on it. Reliability can be determined by this term consistency, the one we have just used here. Consistency with the other studies. You cannot find out tomorrow that when HIV/AIDS is not caused by a virus, yet other studies have said it is a virus. You cannot say tomorrow you have produced a vaccine against, you have produced a cure against the virus. Yet, we know we cannot cure viruses apart from controlling them and preventing them. So reliability, we can use consistency to determine whether your work is reliable. Then ethics in data collection, this is a very important term. I've already said we are going to have a full theme talking about research ethics. How do you preserve patient rights or participants' rights? So this means ensuring that research participants are treated ethically, are treated in a humane manner, you get it, and their rights are respected during the data collection process. You cannot use someone because they are vulnerable to that condition you are investigating, and you just force them to become participants of the study. They retain their rights unless they are minors. But even if they are minors, those are the people below the 18 years, those are the people who cannot have the decision-making capacity. However, unless they are minors, and those ones even, it doesn't mean you're going to use them the way you want. No, you must reach through their caretakers or other people who are concerned with them. So, ethics in data collection is a very important term. Other terms include data management, because the data you are storing, it will be analyzed either immediately or after some time. But how are you keeping that data? How are you managing that data? Again, such that others cannot just access that data and use it the way they want. So it is the organization, storage, and maintenance of collected data to ensure its security and accessibility for analysis. Like I've told you, you might either be wanting to analyze your data immediately or later, but how are you keeping that data? How are you going to, in fact, these are things you indicate in your research design. When you reach research methods, discuss about the research protocol or the research proposal. In the proposal, you must illustrate well how your data will be managed. Will you put passwords on the flash disks that you shall use? Or in case you're going to use the hard copies, how are you going to keep them? You get it? So that is data management. You must illustrate. We shall see how you can better illustrate and have data management procedure. Then data visualization. It is the representation of data in a graphical or visual format to facilitate understanding and interpretation. You see, most of the times they tell us that reading, especially they usually refer to Africans, that if you want if you want to hide something from Africans, put it in writing. Usually they say like that, though at some point they lie. However, even if that one is put into consideration, if you limit wordings and instead present your work as a graph, there you make the reader, it becomes easy to read, interpret, and understand your work. You get, if you use the pie charts, you get it, and other illustrative figures that we can use. That's under data visualization. However, it all begins with data collection. Then data mining, it is that process of discovering patterns and relationships in large data sets using various techniques from statistics and machine learning. Yeah, discovering patterns and relationships in data sets. You have collected a huge amount of data. Among your data, we have demographic characteristics, we have other variables. But demographics alone, you have age, you have sex, you have history of, education, you have social income levels, and other things under demographics. Then you go to other factors. Other factors, you have the salt intake, you have physical exercises daily, you have type of diet. These are very many factors you have considered. So when you try to discover relationships and patterns in these large data sets, meaning you are conducting a process called data mining. Going to the next slide, we have targeted groups in research. This is very important because as you are formulating your research, it helps you to come up with the group you are targeting. First and foremost, the general population. We form these researches when we are targeting the general population. For example, you can do a research in Uganda. You can do research in South Sudan. You can do a research in a particular state of South Sudan, for example, Rumbek. You get it. or Juba. I'm doing on a particular state. However, I'm considering all the individuals in that area, whether you are vulnerable or not, whether you are at a high risk or low, whether you are aged or young, whether you are male or female. That research will be considering all categories of demographics in that particular population. That's what we mean general population as a targeted group. Then specific demographic group, this is when you bring about among adolescents. We're doing such and such a study among women in reproductive age. They're doing such and such a study among women in the postmenopausal period, those who have gone beyond menopause. You are doing a study among a men who are in this and this age group. That's what we mean by specific demographic groups. Then another targeted group is the patient or clinical populations. For example, these are the people who come to our health facilities. I can decide to make a study on growth monitoring, that is a study under nutrition, to make a study on growth monitoring among children admitted to Gulu Regional Referral Hospital. Those who are coming I'm only concerning only those children who are being brought to Gulu Regional Referral Hospital, who are brought when they are sick. So once I do a study on those, those are a patient or clinical population. I can do on mothers admitted on ward, or those who attend antenatal care. You get it? Because sometimes there is a research you do when you are targeting pregnant women, meaning even if you might not consider the health facility alone, but you have to go to the community and look for the pregnant women. You get it? However, there are cases whereby I will get those ones who visit the health facility for antenatal services. That is also a patient or clinical population. Then vulnerable groups, I can decide to get only those ones who have been exposed to the risk factors. I can decide to get the prevalence of lung cancer among men who smoke cigarette. I can decide to get the prevalence of HIV/AIDS among commercial sex workers. It doesn't mean that commercial sex workers have HIV, but they are vulnerable to it because they have multiple sexual partners. You get it? Those are all vulnerable groups. We can have age groups which they lie under specific demographic groups. However, they are also vulnerable because of that age group. That age group alone makes them vulnerable. For example, the aged people who are 65 and above, the elderly, those ones are vulnerable to very many conditions. So I might do a study on the adults aged 65 and above, on the elderly population, meaning I have considered the two types of targeted groups here. I have a targeted group and a specific demographic group, that is age, men aged 65 and above. I can also have a type of targeted group as those who are vulnerable. You get it? Those are all targeted groups in research. We can also do a research on professionals, experts, or key informants, whereby this population, they have a lot of information on something, and I do a study considering those ones as my participants, and I collect information from them regarding my problem of interest. That's what we mean by targeted groups in research. Those who have just come in, we are discussing data collection in research. That's what we are discussing. Data collection tools, we have, okay, these are the instruments used to gather information, facts, or statistics for analysis and research purposes. These are some of the associated gadgets that we move with to our fields for data collection. Even if you're not moving into a field of data collection and you're sitting in one position, for example, if you're doing a secondary research, you need these tools. All of them, they're important in both types of study. First and foremost, hard copy questionnaires. By hard copy, I mean those ones which are printed. You get it? I mean those ones which are printed. So you print your questionnaires, go to the field, administer them to your participants, they fill in, and then they return the answered questionnaire to you. You get it? They return a fully answered questionnaire to you. We have checklists. Checklists These ones can also be usually these ones are the investigator administered checklists, usually whereby you can only give someone to tick for you what they are seeing. Otherwise, it is you. You go into a community. We usually do checklists under an observational research study. I go to a community. I try to observe how do they do this? How are they doing this? How are they undergoing such and such challenges as I tick on my checklist? You get it? Yes. When we are in research methods too, I'll give you samples of questionnaires and samples of checklists that you can use that we can use under research. I'll give you various samples such that they can aid you when you are developing your research proposal. Another data collection tool are cameras. You can use your digital cameras to take pictures. I can observe something in a market. I want to see what they are going through. You get it. I want to present it in my research study. Therefore, I can use a digital camera to take pictures and then try to have digital voice recorders whereby I can administer. I can try to interview an individual. I can interview an individual while recording their responses. You get it? However, you do all of this when an individual has consented to you to record their voices. Very many individuals do not want that. We are going even to see it under research ethics. I told you I'm going to provide. We're going to have a full theme discussing about research ethics. Yes. Another tool are the ICT gadgets. ICT, the technology, including smartphones, laptops, tablets, and all other ICT technological materials. These ones can do all sorts of data collection. You can have your questionnaire on the phone, on the smartphone or laptop. You can have a checklist on the smartphone. You can use your smartphone to take pictures. You can also use your phone to record the voices. So you find out that the more you incorporate technology into your research design, the more the research process becomes easier. Going to the next slide, we get the methods. These are the types of data collection. We are going to see each of these ones in details. What you're seeing are the types of data collection methods. We have statistical methods, surveys, polls, interview, Delphi techniques, focus groups. Oh, those ones are primary data collection methods. And then under secondary, in the earlier topics, I discussed about primary and secondary data collection methods. Whereby primary, you're doing a raw research. Raw meaning there is no you're not building on some other person's research. You get, and you're collecting information by your own from the field. While secondary data is done on individual research reports. Other people did their own research, and you're trying to refer to that research. You use those reports and you come up with an analysis. That's secondary data collection. And the methods can be reports, government reports, mission statements, and the other methods. Going into details, the primary data collection methods may include surveys. These involve collecting data from a sample of individuals through questionnaire. Once you administer, please, Benjamin, mute. Okay, good. I was talking about surveys that these involve collecting data from a sample of individuals through questionnaires, through interviews. You get it. Once you administer such tools, you're using the survey method. So surveys can be conducted in person, over the phone, through mail or online. I can administer my questionnaire to an individual via an email. I can administer the questionnaire via WhatsApp. You get it. I think we have received a certain link recently recently collecting someone was doing a research. You get, or I can perform an interview online through a meeting like this Google Meet. You get it. Those are all ways that surveys can be done under research. So they are useful for gathering information on attitudes. What attitudes do people have over contraceptive use? We can seek for opinions. What opinions do they have over the way we are administering the vaccine? It is also important for gathering information on behaviors, on demographics. You get, eh? Yeah. So under this method, researchers work with the questionnaires. So that is the survey method of research. Then another method are the interviews. We can have interviews. These involve direct interaction between the researcher and the respondent. You might not be having a questionnaire at hand. However, I can be asking questions while recording or while taking information of what they are saying. Interviews can be structured, semi-structured, or unstructured, depending on the level of flexibility in questioning. So these ones allow in-depth exploration of topics and provide rich qualitative data. Here, I can, you have seen some questions that whereby any investigator gives a question and gives you options to choose from. You get it? The investigator gives you options to choose from. For example, what is your age? And an investigator has given you options. For example, option 1 between 10 to 20, 2 21 to 30, option 3 31 to 40. You get it? Yes, those are options whereby you don't have a chance to fill in anything that you want. You have to only tick from there. Yes or yet? You're raising up your hand?
No, no, it
Okay, I
was a
guess so.
mistake.
Just
Sorry.
oh, okay, it's okay. Yes, I was saying that is a structured interview. If an individual gives you a question but limits you with options, someone tells you, gives you options to choose from, you get it. That is a structured interview. Then a semi-structured interview, an individual gives you options but leaves for you a space. In case you don't have any of those options, you can says, for example, you can see, what is your age? Then it is 10 to 20, 21 to 30, 31 to 40. Then on the fourth option, someone says others. In a bracket, please specify. You get it? That is a semi-structured interview. You get it? In case I ask you a question, I give you options. However, if you think among the options I have given, there is none that you take, I leave you a space to fill in your opinion. That is a semi-structured interview. Then unstructured interview, this one we don't give you options. We just ask you what is your age, and you just give anything under your age. You get? What do you think on this? You just give whatever you're thinking. You get? Yes, I guess you have understood there was the three types. I've said one, we give you options and we limit you, whereby you have to choose from those ones given. Then the second type, there are cases whereby we give you options, however, we leave for you a space to choose in case none of the options calls for you. Then the third type, we don't give you any option, you just give your opinion. Another method is observations. Here, this is where we say that checklists are very important. Whatever you observe, you tick. You observe, you tick. You get. Observations involve systematically watching or recording behaviors, events, or interaction in a natural setting. This method is useful for studying behavior in its natural context, how people behave naturally without interference with the researcher's presence. You get? In other words, under interview, someone will know that you are actually interviewing them, that they even have consented to participate in your study. However, for observation studies, we shall not seek a consent from you. However, the consent which was sought was obtained from the administration, usually at the district level or at the sub-county level. Those ones might have allowed me come and make observation and try to collect that. However, I don't engage any participant under observation. You get it? Yes. That's why you have said the researcher, you want to observe individuals or you want to observe something happening without actually those people knowing that you are observing them. That's what we mean by observation. Then experimental, those are as a method, a primary method. These involve manipulating variables to observe their effects on outcomes. We try to put in some factors and watch them how it happens in the end. If you watch the video or if you attended the lesson on research designs, you might have seen the experimental type of study. So I don't think I should go so much deep into these ones because I gave the details. Then another method is the focus groups. These ones involve bringing together a small group of individuals to discuss a specific topic guided by a moderator. Yes, this method is useful for exploring complex issues, understanding diverse perspectives, and generating insights through interactions. For example, you as an investigator, you can find a group of 5 to 12. Usually focus groups are from 5 to 12. I didn't indicate that number here, but I will ask it when we come to that point of assessment. I will ask for it. So I've said these ones are always from a group of 5 to 12, and the investigator brings in a topic, and then the participants start discussing as he records, as the investigator records. So these participants are a certain group. They can be adolescents, they can be school-going children, they can be professional workers, for example, lecturers. You get it. These are all can form focus groups. Then secondary methods, literature review first and foremost. So this literature review as a secondary method, almost each and we perform it in all primary researches because as you're going to handle primary research, you must perform literature review. You must read other people's papers concerning that problem you are investigating. You might seek for their opinion, and at least it can even give you an insight on the methodology you can take. We're going to see details of literature review perhaps in the next research. In the next topic that we shall discuss tomorrow. A literature review. Literature can include journals, books, and reports. And we can use these ones help researchers to understand the current state of knowledge in their field and identify gaps or areas for further research. Doing a literature review helps you to identify the significance of your study. For example, you might want to do a study, you want to find out whether smoking causes lung cancer. Yet very many people have done research on smoking and lung cancer. Meaning, is your study going to be significant? No, because there is no new knowledge you're going to give us. There is no gap that you're going to be filling. You get? Yes, that's why literature review is important, and it is a secondary method. I said secondary methods, we try to obtain information from other people's research, from data that was collected by other people. However, I've told you we are going to see details of literature review, perhaps in our next lecture. And archival research as a method, archival research involves analyzing historical documents, records, and data sets to extract information relevant to the research question. I think this one is clear. I gave it as a type of research under introduction. So whereby here we consider documents that pre-existed, talking about the history of something. We try to organize these documents, we try to analyze them, and come up with a report that becomes an archival secondary method, an archival secondary method, an archival method of secondary research. So this method is often used in historical research, which requires longitudinal data analysis. Longitudinal, we mean you want to investigate certain trends in something over years. How did it happen those days back? You get? Like I told you recently, I have a goal perhaps in May. I want to do a research on hand hygiene diseases and their prevalence over the COVID-19 era. I want to do that research soon. Yeah. And that is an archival research because I'm going to look at archives. You get it? I want to go get data from 2015, that is before COVID-19. I want to get data through COVID-19 when it has come. And I want to get data at the period whereby COVID-19 has just ended. Yes, I want to see how were hand hygiene diseases managed. I want to see how the hand hygiene standard operating procedure was helpful. So that is becomes an archival research. It is longitudinal because we are trying to observe a trend over a period of time. Then a meta-analysis as a secondary method is a statistical technique used to combine and analyze results of multiple studies on a specific topic. We get a topic on, for example, contraceptive use in Africa, and then we collect all the documents regarding contraceptive use in Africa, and then we try to perform a meta-analysis. I will form a group. uh, I'll form a group of my individuals, but I remain the primary investigator. And the other individuals, I'll give them their own documents to analyze. However, those documents should be from contraceptive use. You get it? They analyze, I analyze. We are a good number, for example, not less than 8. We perform this meta analysis on a particular topic called the contraceptive use. Therefore, by synthesizing findings from different studies, researchers can draw more robust conclusions and identify patterns or trends that might not be apparent in individual studies. For example, like I've stated, contraceptive use. Someone might have written some information and it doesn't have a good background, or something was skipped. Therefore, when we perform a meta analysis, we analyze very many results of multiple studies on that particular topic called the contraceptive use. We try to come up, we try to fill gaps that were not filled by the other papers that were written by other individual researchers. You get the importance of meta analysis, eh? Yes, that is a secondary method as well. Then publicly available data. Here, researchers can access these available data sets. For example, government reports. To give you an example of population census reports from the statistical boards. You get it? Population census, those are very good publicly available data. Then we can also use data from surveys, databases, and we can use these ones to analyze patterns and relationships in the data. Publicly available data sources provide a wealth of information that can be used for various research purposes. Then the other secondary method is the commercial data sources. These ones can include market research reports. I gave these reports under the examples of when I was giving on the first slide considering types of these methods. So commercial data sources can be market research reports, industry publications, proprietary databases, and these ones provide a valuable insight into consumer behavior, market trends, and competitive analysis. So you find out that this method is not so much applied in health. However, you can also apply it. You find out that very many health facilities right now, whether public or private, are asking for money and you want to investigate, you get, on their receipts and how they have been trying to charge patients. Is it in a harmful way or it is the recommended way? You get. We can also use them in health anyway. Researchers can purchase or access the data sources to inform their research, and decision making processes will become easy. This is our last objective for this lecture. That is community engagement strategies. How do you engage your community when you are going to collect data? First and foremost, community-based participatory research. This is a collaborative approach to research that involves community members as equal partners. Individuals in the communities are collaborators under this type of strategy, whereby all this strategy emphasizes building trust, sharing power, and fostering mutual learning between researchers and the community members. It makes it easy. In fact, the non-responders will be very few once you try to collaborate with your very community where you're going to conduct this research study from. Another strategy is stakeholder engagement. We can engage stakeholders in this category. For example, this involves identifying and involving individuals or groups who have a stake in the research outcomes. This may include community members, policy makers, advocacy groups, or other relevant stakeholders. Engaging stakeholders helps ensure that research addresses their needs and concerns. Stakeholder engagement, this strategy is very important in the snowball type of research design or in the snowball type of sampling. Yes, it is under sampling. There's, whereby here the participants under the snowball type of sampling do not want to be identified by others apart from those people they are working with. So you find out that these participants have only one person they can trust, and if he tells them that please let us participate in this study, it is important for us and your data will be kept with secrecy. So these people will come out and you make the study on them. I usually use the example of commercial sex workers. They have their bosses. They are very strong stakeholder and they're very strong stakeholders in this category. You get? We have HIV/AIDS positive patients. No one wants you to tell others that I'm HIV positive. However, they have their health officers who work on them or they go to the health facility. So you can reach out to him and then that person contacts those people who are positive and then you collect the data from them. That is the strategy under stakeholder engagement. I've told you the very, very important stakeholders and where and under which method they can help us from. I might want to do a study on people who take marijuana. Sometimes in some countries, taking marijuana is a crime or other drugs. It is a crime. However, these people will do these things in hiding. But much as they do these things in hiding, they have their people who sell these things to them. And you want to interview those people. Remember, they will not just come out anyhow because there is someone. You will not just ask someone that you take marijuana or any drug. They will not accept that I don't take because they fear to be arrested. However, if you reach through those people who sell these things who sell these things to them, these people know their own and know how to handle them. Those are very strong stakeholders. Another strategy is capacity building. This strategy focuses on enhancing the skills, knowledge, and resources of community members to actively participate in the research process. Here, you might want to conduct this research study. However, some of the methodologies that you have indicated in your protocol, people cannot use them or they cannot rely well with them. For example, self-use of the glucometer. The glucometer, the one which can measure blood glucose levels. It is a newly invented method whereby those people who are known diabetics can use it to monitor their blood glucose levels. You want to do this investigation to see whether they can use this glucometer. However, they didn't go to school, but even if they went to school, there's no school teaches about glucometer use. You get it? Therefore, as an investigator, you might first want to introduce this glucometer to this community. You get? Those who have just joined in, we're discussing a lecture on data collection techniques. So, and I'm on capacity building as a secondary data collection method. And I was giving an example of glucometer, and I was saying that there is no school teaches glucometer use apart from health training institutions. And yet, you want to perform this study on the community on whether they can use this glucometer. Therefore, you will want to first perform a capacity building and then you train them on how to use that glucometer as individuals. You also allow them to use them by themselves and then you perform the study on whether they have learned how to use. That's what we mean by capacity building. So, this strategy may involve providing training, workshops, or other educational opportunities to empower community members contribute meaningfully to the research. I think I have given a good example and capacity building as a strategy to engage your community. I've said that these strategies I'm giving are under community engagement strategies. We have already seen the types of data collection techniques. Uh, Other strategies, we can have cultural competency, whereby in research, this involves understanding and respecting cultural norms, values, and the beliefs of the community being studied. Researchers must be sensitive to cultural differences and adapt their approaches accordingly to ensure that the research is conducted ethically and respectively. I can give an example here in Uganda. Um, because that's where I live right now as I'm teaching you online. Here, there is a tribe called the Baganda. The Baganda people expect a woman to kneel down when you are greeting them. And if you are a man, you should stand gently when you are greeting them. Therefore, if you, the investigator, you are a woman, an individual or a participant expects you to start by greeting them and greet them while you are kneeling down that good morning, sir, good afternoon. You get it? And before you start engaging them in what you have come to do. And if you are a man, you should stand gently. You get it? Here, you will have pulled their attention and they will attend to you very well. I'm talking about cultural competence. You must first understand the culture and the nature of the people from which you're going to collect your data. Know what they want. Know the types of words that you should not use. You get? We have cultures that they don't want to hear some words, and once you speak of it, they will even kill you from there and then. And you now, the investigator, you just come anyhow, and you just start saying such words without finding out what those people don't want, and you might lose your life from there and then. So understand the culture of the society from which you're going to collect your data. Dissemination and knowledge translation as a strategy. Uh, Effective dissemination of findings is crucial to ensure that the results reach and benefit the community. We have publishing as a strategy. Sometimes you might not be having the cash or the requirements for publishing your work. However, you can reach out to your institution. These institutions have what we call a repository. I'll get in touch with the program coordinator, perhaps Mr. Samuel. I'll get in touch with him and we see whether we have this repository and it is like an online library whereby we can upload our research reports after conducting them as you get your money for publishing in a medical journal. Usually, it is important to disseminate your findings such that the society from which you collected the data can benefit. Knowledge translation strategies involve translating research findings into accessible formats and disseminating them through various channels to maximize impact and promote informed decision making. I guess these strategies have reached home. The way you can engage with your community. Those who came in late, I think you'll try to consult the channel where they are uploading these lectures, or you can reach out to the program coordinator and see how you can be helped. Um, Please note that a very, a very crucial aspect in data collection is ethics. I repeat, note that in data collection, a very crucial aspect is ethics. How are you respecting the rights of these individuals that you are engaging? As an investigator, you must understand the ethics of humanity in line with that particular community that you are going to engage, such that you have a peaceful and successful research process. Therefore, ethics under research are going to be discussed in detail under the theme research ethics. I didn't include the data collection ethics here because I thought that you wouldn't pick the concept very well. Therefore, I'm going to give you a very good detail of how you can protect confidentiality, how you can ensure privacy, how you can ensure that these people's rights are very, very well protected. And You must indicate this under your research proposal. You get it? We are going to see when we are covering research methods too, on how you can include ethics under your research under your research proposal. But it is a very crucial aspect, and please don't worry, we are going to discuss it in details. Otherwise, today's lecture ends here, unless there is a question. However, like I always do, I display the lecture objectives such that members can see whether we have tried to achieve them. Those have been our data collection techniques that we have discussed today, and these are the objectives that we wanted to achieve. I guess those who were with us from the start can see that we have tried to achieve these objectives. Those who came in late, Dennis, the good thing with you, Dennis, you're always on. That's the good thing. I've never seen you missing in lecture. Yeah, but others, in case you have missed, you please go and watch. Those have been our lecture objectives for today. I guess they have been achieved. Otherwise, thank you. I can have a comment from Oyet. Oyet, please try to comment about the lecture such that we can close. Yes, Oyet, please go on.
All right. Thanks so much, Mr. Kato Alex, for the wonderful lectures. I really enjoyed so much. It's my first time today. This because I was enrolled in this module a bit late, and I don't used to miss lectures, but I was enrolled a bit late in this module. That's why I joined late. However, the lecture is so interactive and it's so good. Then I would like to add something on the observation. One real example we can say, like, if you're asking somebody about, like, you want to know about the gender of the person, you don't need to ask, so are you a female or male? So if you are seeing the person, so you just observe and you feel in. So this is what I can say. Thanks so much.
Okay. Thanks so much, Oyet, for the compliment. It has been very good. Yeah, you even gave in that supplement on observation, and I had to play to that slide so that other members can see what you're talking about. Thank you so much. Of course, you don't need to ask someone, are you male or female? You get it. You can just see and then click. Thank you so much for that. Others, I just hope it has also been wonderful for us, like Oyet has said. Otherwise, I wish a good night. Let's meet up tomorrow. Before I close, I'm updating for those members who have just started with us today. We always have research methods on Wednesday, Thursday, and Friday. I always teach research methods on those days. Uh, just to introduce myself, I'm a researcher from Uganda. But I specialize in non-communicable diseases and HIV. That's my area of specialty. However, even other studies, once it comes over, I try to guide. But I'm a researcher and I've published some good work. Yeah, and I'm a public health officer by profession. Still, just to know me more. However, I wish you a good night.
Thank you. Thank you. Have a good night too.
Good night. Thank you.
Thank you. Good night.